So good morning. I'm Kathy Matt, and I'm Dean of the College of Health Sciences, and I want to welcome you to this morning's program. You have an exciting morning planned for you, and I think you're going to enjoy this. You will, I think, be able to take a lot back to your practices. What we're going to do, as we usually do, is to begin the program actually with a simulation by our wonderful team from Healthcare Theater, which is in the College of Health Sciences. So I think with that, we will open the show. And I'll introduce Alan Carlson.
Thank you, Dean. Good morning, everyone. It's showtime. So I'm not going to really say much. All I'm going to say actually is maybe a look at several spaces in a primary care center. Okay.
Thank you, Caitlin, for bringing me today. I know you're really busy at school, and I appreciate your driving me here because your mother can't. I hope we don't have to wait too long. We did come early. Maybe we can get in sooner.
That's okay, Grandma. I can read while I'm waiting for you.
Oh, crap. I left my medicine at home by mistake. I hope Dr. Rutherford isn't going to be too angry. I know he has a list of my meds, but I did get a call telling me to bring them today.
It's okay, Grandma. I'm sure they have a record of your medication on the computer.
Hello, Florence. You certainly are the early bird today.
Ah, yes, we were hoping to get in to see Dr. Rutherford rather fast. My granddaughter's got to go to school. Kathleen, I just noticed I didn't bring my medicine today. Can you believe it? I grabbed my knitting by mistake.
That is interesting. They're just going to have to see what they can do without it. Florence, I don't remember seeing you with a walker. Did you have an injury?
Nah. Dr. Rutherford sent me to see that Dr. Sloan because my arthritis has really been painful. She gave me some new medicine in this contraption. I feel really ancient using it, but I'm trying to get used to it. Can we go back to see Dr. Rutherford now?
They're not quite ready for patients yet. If you can just fill out these forms while you wait, and they'll see you as soon as they can.
Well, Dr. Newton's late again. He's been late at least twice a week for the past 3 months. You know, I bet we'd hear about it from the practice manager if we were late like this. Dr. Rutherford is also late. I guess you didn't hear. Dr. Rutherford called the service and left a message this morning that he won't be in today. I think he said that you should see his patients.
Again? He keeps doing that, and...
Okay, let's go. First up, we've got Rachel J. going over test results and following up on our asthma. Should be routine.
I'm seeing both Dr. Rutherford's patients and my own today. Florence L. is first. Reading through her last note, I see I need to follow up with her labs and medications. She was sent to a physiatrist, Dr. Sloan, for pain, and I'll see how she's doing. There's no consult note in her chart. She should have gone there by now.
I saw Florence in the waiting room. Dr. Sloan has her using a walker now. She also gave her some new medication, but Florence forgot to bring it with her today.
Kathy, could you please call Dr. Sloan's office for her notes so I can see what happened at their visit?
I can try, but I doubt anyone will be in the office this early.
Okay, next patient. Michael S., smoking cessation. Kathy, assess where he's at in stage for readiness to quit when you check him in. Gina, who's next for you?
Ellen R., GYN exam. Kathy, I will need you to assist with the pap smear.
Okay, but you'll have to wait if I'm helping Dr. Newton.
Next is Sam L., wants to lose weight. Would help if he'd actually try to diet.
If he's been having trouble and his blood pressure's okay, I've been having good success starting patients on phentermine to help suppress their appetite.
I'll decide what's best for my patient, Gina.
Okay, I just thought I'd mention what's been working for my patients.
Okay, that's it for now. We can meet at lunchtime if necessary. Any questions?
Dr. Newton, I wanted to mention to you how challenging it is to have to see Dr. Rutherford's patients and my own when he cancels at the last minute. Not having time to read up on his patients is really impacting the quality of care I strive to give all patients. Perhaps you could suggest to him that he call and give us more notice if he's going to be out so that his patients can be rescheduled.
Gina, it's a fact of life that primary care clinicians need to see more patients in less time because there's just not enough of us. You're not really involved in the business end of the practice, but we have to be careful because revenues are down and expenses are up. You know, value-based care means that we have to do more for the patients with little reward. They may not have taught you that in your NP training school. Listen, if you can't roll with the punches, we may have to reevaluate your work here in the practice.
Hello? Is anybody ready to see us yet? My granddaughter's got to get ready for school.
It's okay, Grandma. They'll get to us as soon as they can.
Hi, Florence. It's good to see you again. Come on back. We'll get you checked in.
Kathy, remember I need information from Dr. Sloan's office about Florence's last visit.
It's barely 8 a.m. I told you they wouldn't be in the office yet.
Good morning, Mrs. Lawson. I'm Gina Osman, the practice nurse practitioner. Dr. Rutherford's out today and he's asked me to see you. How are you doing?
And the end. How are we doing?
Tepid applause.
A little look into the primary care center. Dr. Barrett, yes? Before we go forward and have a little discussion here about what you just saw, I think I'd like to take an opportunity to let our performers introduce themselves. They're all members of our healthcare theater program here at the university, and I think you'll be interested to also see not only who they are, but also what they do here at the university. So starting over there with Miss Kathy.
Hi, good morning. I'm Kathy Conrad. I work at the College of Agriculture.
You can stand up, please. Okay.
Hi. I work at the College of Agriculture and Natural Resources as an administrative specialist.
Hi, I'm Frank Newton. I'm Associate Dean in the College of Health Sciences.
I'm Gina Osman. I live locally and am a medical and technical writer and editor, and I'm taking the healthcare theater class this semester for fun.
I'm Kathleen Becker. I am a senior undergraduate at University of Delaware studying speech-language pathology, and I am assistant coordinator here at Healthcare Theater.
My name's Sandy Stilts. I am also an assistant coordinator here at Healthcare Theater, and I just recently graduated from the University of Delaware in psychology.
And this is our diva, ready to stand. She has been with us
And
since
I don't
the
have
beginning.
arthritis.
And you are?
I'm Linda Hanker. I'm retired RN. I live in the community, and I've been with Healthcare Theater for, I think, 8 years. I'm also a volunteer with Wilmington and Western Railroad and the Etna Hose Hook and Ladder Fire Company.
So those are our performers, yes? And just to make the interprofessional thing kind of come full circle, my name is Alan Carlson. I'm Director of Healthcare Theater, and I'm from the theater department here at the University of Delaware. Comments, sir?
Yes, so my name is Barrett Michalik. I'm the Associate Dean of Interprofessional Education here at College of Health Sciences. And so I'm here to kind of introduce you to this module. Kathy will also do some more introductions in a little bit. But I want to open it up to offer any comments or ideas that you have with what you just saw. Besides it being fantastic, of course. That's the first time I've seen it live, so it was really great. Yes?
It was reality.
Was it reality? Yes. Yeah.
Primary care office patients show up without their meds. They forgot their
Here.
meds.
Why don't you
I said it's reality. It happens all the time in primary care. People show up without their meds. We try to do huddle. Doctor, I don't want to say he was rude, but he was. but I mean, I know he was, you know. But I mean, it does. People get busy, and you know, I understand the nurse practitioner. She's taking on patients that aren't hers, and she hasn't had a chance to do her chart prep. You know, so it was great. It was more going on, but I'll let somebody else talk.
Anyone else want to offer any insights? Sure.
I agree with Edna. I felt like the providers, the MP, the nurse, the OA, the MA, like they weren't supporting one another in their thoughts, hearing what was really going on, hearing the need for the support. It wasn't delivered at all.
Sure. Hand over this way.
I just had a doctor's appointment yesterday, and now I feel like it was all a fraud. In that everybody was nice to me, but I'm thinking behind the scenes, maybe it wasn't so nice. And I think that, I feel like the genuine concern for clients and patients is something that you can't fake and act. These guys did a great job, but that's something that if your heart's not in it, it's going to show eventually. So, yeah.
Anyone else? Some thoughts about what they've seen? Yeah, sure. Yeah.
I'm not from the medical field, but I've worked in state government and community-based agencies throughout my career, and it's eerily familiar to social services, domestic violence programs that I've worked in, where you're facing similar challenges, where people need information or facing challenges just to get into the service, to go through intake or receive the services, and the coordination and information that's needed, and how challenging that is to provide that. So, see, they're not alone. Primary care is not alone.
Right. Well, it's the truth, right? So a lot of these things, when we're talking about interprofessional practice, team-based care, collaborative practice in general, they speak to a lot of different arenas. We're focusing on primary care here with these modules. However, this can speak to a much larger issues. And some of the things that Dr. McKenzie and I will be talking about today can actually impact your personal life as well. So we're trying to kind of make that transition as well from work-life balance. We're getting set up for a little bit here, just getting the computer ready for the next modules. If there's any other thoughts about what they've seen, anyone's seen that they want to bring up, sure.
I agree with you. It's the lack of team-based care that we're missing. At the same time, because of it, we're losing the patient and family engagement.
Yeah, so some of the things we're going to be talking about today and focusing on have to do a lot with the patient connections, provider and front office staff and that kind of thing with the patient and the patient's family, but also with colleagues. One of the things we tend to lose sight of often is our connectedness in our relationships with our own colleagues and how that can lend to collaborative practice. So as we continue to move forward, getting this all ready, these are all excellent kind of works in progress. This is a team right here. You can see we're all moving together, working in parts. Is there any other concluding thoughts? If not, we'll just take a few minutes just to get set up and then we'll get moving again. No? Okay, great. Well, we'll get set up and then we'll start right off.
So grab coffee
Yeah.
or food and we'll be